go. What is up, y'all? It's your girl Jice, and we are back with another episode of Boss Up with BBI, where we are here talking about all things money and mindset in the Black community. And so, as promised, I told you that we were going to get into some things that were health related. We were going to get into some things that are policy related, because as I mentioned in last week's podcast, we have to really start understanding how important policy and legislation is to our community, as well as how we begin to access these resources, and very importantly, thinking about the things that we're thinking on and how we are oftentimes focused in the wrong direction or on the wrong things. And so one of the goals that I have for this year is how we just continue to push forward and think about those things that we should be focusing in on, and try, I'm gonna do my part to try and redirect and focus us into some of those places and spaces. So make sure that you like and subscribe to this podcast. Make sure that you share it. And also I have been making this push, and I'm just gonna keep making it, to support independent Black media. So there are multiple ways that you can donate. If you are on Anchor, you can donate that way. And as well, you can go to BBIProfessional.com. We do have a fabulous donate button sitting right there in the footer for you. And then, of course, if you are on YouTube, make sure you subscribe and share. And also, this is not one of our live, but you can also make sure that you're tuning into us live, and we have activated super chats and other things like that. So we have all the ways in the description. We have Cashapp, we have PayPal, we have all the ways that you can donate and help support independent Black media. So today's episode is sponsored by Connect for Health Colorado, and I'm really excited to bring our guest on here. And so Mr. Kevin Patterson is going to talk about his history, because y'all, it is like, he's dope. I was gonna say,
oh, whatever.
You're dope. So, but you know, so I would not do him justice if I tried to break down a lot of his history and where he's been and what he's done that has brought him to this current place. But what I will say is that he's been active and advocate in our community. And so I want to let him introduce himself as we kind of dig into a little bit about his organization, and then we'll be taking it from there. So.
Well, Jice, thank you so much for allowing me to come by. I really appreciate the opportunity. So a lot of folks do know who I am, but let me just make sure I put it out there. I started out as a 7th grade English teacher on the north side of Houston.
Okay.
I thought I was going to be a principal, drive a nice car in Texas, and I was going to be good. Well, I met this cute little girl who used to live across the street from my dad, who's from Denver. And you know how that kind of turned out, because here I've been for the last, I don't even want to say how long.
Don't date yourself.
Well, you know, I can say this, that our high school in Texas was in the finals, and we had this running back that was just tearing us up, Fort Bend Willeridge. I'm like, who is this dude? Because, I mean, he was killing us. And somebody asked me, I said, I got to go back and look. It was Thurman Thomas.
Oh.
That's who we lost to in the state.
Well, look, you can't feel that bad.
Yeah, you know, I think we had a pretty good year. Right. So I just dated myself, so I just got that out there. So when I got to Denver, I ended up working for Governor Romer, doing constituent work, and a year doing legislation. So I was with him for about 3 years. Decided, you know, when they told me I had to go back to school to start teaching all over again, I'm like, well, that doesn't make any sense. So I decided to get a master's degree. And I was at the School of Public Affairs. It was the Graduate School of Public Affairs back then. And I was working on my master's there. I was at the city's budget office. I was there. I had a chance to work with Wellington Webb, and that was so much fun. I actually had the mayor's budget, which taught me a lot just about how budgeting really works and how they teach you how it works.
That part, how it really works, right, and how they teach you how it works.
Yeah, there
and
is
for those of you that aren't from Denver, from the Denver area, Wellington Webb was the first Black mayor that was elected here in Denver.
So that was interesting, and I had a chance to work for Denver Public Library when they were expanding. I had a chance to work at Denver Human Services, so I got to understand the county side of what Denver does as well as the city side. So I was in the budget office for about 6 or 7 years. They were looking at building a new planning department. I thought they might need a finance person over there. They actually agreed with me, so I ended up over at the planning department. Started out as 75 employees. We ended up putting 5 different departments together, creating what's now community planning and development, when it was just planning and zoning. And so we created a whole new cabinet department, which I'm you don't get a chance to do that all the time. That's kind of fun.
That's right.
So that was fun. So I was working there for about 5 or 6 years. During that time, I ended up running for school board. That's a whole nother conversation.
But you were elected twice.
Twice, yeah.
Okay.
I served 8 years, so thank God for term limits. It was hard to go to the grocery store, girl. I'm not gonna lie. I mean, everybody stops you when you're trying to pick up something for dinner that night. Hey, I'm trying to get my kid into this school. Hey, I need to be a custodian 3 and I'm a custodian 2. I'm like, I'm just trying to get home and cook dinner. It was just so difficult.
If we end up getting a chance to circle back to that, I think that's a key place that even when you said what they teach you about budgeting versus budgeting,
oh yeah,
it's interesting how people view positions and what kind of power they think positions have versus funny. What they really have.
That's funny. Okay, we'll get to that. Because there's the position and there's the work.
Right.
And some people want the position and the title, but you gotta understand the work you really have to do. And okay, we can come back to that, people. That's fine. So after I was on the school board for 8 years, went to somebody's birthday party. This guy with a funny last name comes, walks to me, tries to get me to support him. I'm like, dude, you're supposed to be talking to all these other people. Why do you keep bothering me? I was just coming because my wife told me I had to be at this birthday party. And I'm like trying to stay out of the race. I got to work with whoever comes in. I'm trying to be non-committal. And there was this whole big thing going on back then. This whole Black-Brown coalition. Everybody was talking about Don Marius. We got to get Don Marius in there. And I'm like, look, I'm just trying to stay stagnant. I got too much going on. I'll be good with whoever you have. You got 2 good candidates. It'll be okay. So he keeps talking. I said, okay, let me look at your education plan. I actually liked it. And I said, you know what? I got to go with the guy with the funny last name. It was John Hickenlooper. And out of the blue, dadgummit, he won.
And he did do that.
Yeah, he won. And so everybody's like, okay, well, now what? So I ended up working with him, and I went over to Human Services and was deputy manager there for 3 or 4 years, and went to the mayor and said, I think I'm ready to run a department. They gave me general services, which was an interesting place, mostly purchasing buildings and grounds. Nothing terribly exciting, but we did a strategic plan. We actually got our projects out and on time and on budget. And the next thing you know, I finished the strategic plan 1 year to the day when I got there. I get a call from the mayor. He says, hey, I want you to go over to parks. And I'm like, no. What are you talking about? I just got this up and running. He says, yeah, I need somebody that can run a department. I don't need a parks person. I need somebody who knows how to run a department. I said, oh, I am a planner by trade. I actually have a degree in that. So I said, all right, let's figure it out. So I ended up over there. They had 40, less than half of their projects from the bond that had been recently passed were on time and on budget. So we decided, since I'm there Monday morning every day because I had to drop my kids off at school, we're going to have an 8 o'clock meeting every Monday to talk about what the projects are. And if your project's not on time and on budget, Kevin's going to have a conversation with you about what's going on. All of a sudden, our project's 92% on time, 90% on budget.
Right.
It was just paying attention to the things that were, it's just like, okay, explain to me why you can't make this work. And they figured it out, but we had to build a system. And I think, having that structure is so important. And we think that these things just happen magically. And the magic is work. The magic is preparation.
Right.
The magic is the details. It's the stuff that nobody really wants to talk about that's really hard. And I mean, I've had to lay people off and see them at the grocery store. I get it. This is very personal. Denver's not that big of a city. I mean, it's bigger than it used to be. But it's
and that's saying a lot because it's still not that big.
Yeah, you see people all the time, and you have to understand that you're going to have that connection with the community one way or the other. So you just have to be real with who you are. So
now, wait, I want to ask you a question.
Oh, I'm sorry.
No, that's okay.
Oh, no, go ahead.
What's your sign?
Show? Well, why we got to go there? I'm Taurus, but I'm just this is very interesting. I did not expect that.
So I just was curious because we were having a conversation today.
I'm curious now.
So I'm working on a project around administrative equity, right? So we understand that 93% of philanthropic dollars go back into the hands of white men. And so we were working on a project with that. And it just so happened when we were talking about personalities, we have a room of professionals that are in the room. And it was like what professionals struggle to do, what types of tasks. And we were kind of acknowledging that there were certain, like Pisces, like myself, who struggle with certain aspects of things, that not to say people who that you wouldn't be a struggle, but that's such an interesting thing because one of the things that I struggle with the most, and almost sometimes why I like even being able to kind of do the online thing, is because it's a little bit more distant, right? And so I can, speak pretty freely without necessarily thinking about who I'm going to offend or who I'm going to run into. I do say names sometimes, but I try not to make that like my primary thing is being a name dropper, right? And so they were saying it's because I'm a Pisces, I'm too emotional, I'm too, close to the situation. So, but I think that's so interesting when you think about those dynamics of having to make the tough choices, having to do things that move your project forward, knowing that it is such a small community and that you are going to run into these people that are, some of them are going to be on your side, some of them are not going to be on your side, some of them are never going to understand and see why you had to make the decisions that you have to make, and still being able to come and present, right? And in the community specifically, trust is such a big thing, and trust can be easily broken even if you're not in the wrong. You could have fired someone or laid someone off for a very valid reason. But if they can't understand that reason, if they can't acknowledge that, and then that trust begins to get broken, I feel like that's some of the areas in our community where we start to see those breakdowns.
I can't agree with you more. I remember when I was at Parks, we were going through 10% reductions every year I was there. It was not fun.
Right.
But for every person that I had to lay off, they talked to me before they left. Because I just didn't think that was I just couldn't do that. It's like, look, it's not personal, but it's like, look, let me make sure you understand. Here's the things that we can do. Here's what we want to do to support you, just to make sure you understand what's going on. And if something comes up, you'll be the first person that we call to make sure that you come back. But it is, I think, you have to remember you're dealing with people. Exactly. And I think sometimes we get into the numbers or about the analytics, and I think those things are important to understand trends and what's going on, so you have the right data to make the right decision. But you are making decisions that impact people. You can't run from that.
You can't run from that.
And I think, but I think people will know that you do.
Right. And I look at that and how that plays a factor into community work and community organizing, in particular grassroots organizing. And it's like, you got to come to the place where you know that everyone is not going to like you. Again, right, wrong, and different, but it's just, having that balance between that and having enough that people know that what you're bringing to the table is still trustworthy, especially in that space of how we move our community forward. And so it's always interesting to me in the smaller communities. I grew up in Oakland. I spent time in Seattle, or the Seattle Tacoma area. I spent time in Atlanta. This is probably the smallest community that I've been in, and I do see the dynamics of being in a smaller community versus being in those larger communities. So that was just something that caught my attention as you were.
I don't think I think that's very accurate. I think we like to think in Denver we're big because when you look around us, there's nothing that really compares without a 2-hour flight. Right?
Right.
I mean, we are the Queen City of the Plains. There's nothing for a good bit of distance, but it is still a lot of that small town piece. It's a lot about neighborhoods. It's a lot about these relationships that you have with people. But so then after I was at Parks, I was there for a while. Hickenlooper comes to me and says, "Hey, I'm thinking about running for governor." I said, "Well, if you're going to do it now, you got to think about it. Do you do it now, or are you going to be 8 years older trying to do it then?" Crazy thing, and he won that one too. So we ended up walking, literally, he signed his resignation letter, walked across the Parks with him over to the state capitol, ended up as deputy chief of staff, did all kinds of fun stuff over there, was back in the building today for the governor said they hadn't been up within a couple of years, and good protest breaks out up there. It was quite the interesting dynamic. I was like, oh yeah, that's the capitol. So that part I don't miss that much. But I had the chance of running a few departments while I was there: the governor's energy office, governor's office of information technology, Department of Local Affairs. And the next thing you know, I'm chief of staff for a while. That was more fun than I wanted it to be. And then when I helped him pick a new chief of staff, his new chief of staff says, "Hey, Kevin, they need somebody over at the exchange." And I said, "Yeah, I know. I was on their board. I don't think so. I just had this conversation with the governor. We're figuring out what we're going to do the next 4 years of plan." All of a sudden, their search didn't go so well. My good friend, former chief of staff, Doug Freenash, came back to me again. And I said, "All right, if you think I can help, talk to this. If the board chair thinks I can be helpful, I'm willing to help."
Okay.
And that was 4.5, almost 5 years ago now.
Okay. And so that has landed you with Connect for Health.
Connect for Health Colorado. So we are the state's, the simple way to explain it is I'm the Obamacare guy for the state of Colorado.
Okay.
So there's a new number. There's a baker's dozen of us that have been operating as state-based exchanges. We're welcoming new state exchanges. I was literally on the phone with them before I came in here with you. And now we're adding New Jersey, Pennsylvania, Virginia's thinking about it, Maine's thinking about it. So other states are trying to break away from healthcare.gov and come over and run their own healthcare exchange. And the reason it was really important here in Colorado, it was at a time when I was still with Governor Hickenlooper, but it was the House was run by the Republicans, Senate was run by the Democrats, and they had to come up with some way that they agreed on how they're going to do this very politically polarizing piece at the time. And they said, "Look, we don't necessarily want the federal government to do it. We need to run our own exchange." We had this Blue Ribbon Commission report that came out after Bill Owens was governor. Bill Ritter looked at it, and it said we need to create a connector, one place where people can go to figure out what they need if they're not having employer-sponsored care. And they said, "Well, why don't we use that report, build our own exchange, and then we'll figure the rest of it out as we go." Well, figuring out the rest of it has kind of waited on a lot of implementation issues around the Affordable Care Act. It was hard for healthcare.gov. We got off to a bumpy start, but we were at least able to open on the first day. But we have actually pulled ourselves to get a couple of national awards for what we do, because we really now focus on what's important for the consumer. And so when I got there, it really was about, don't bring me a project that doesn't help the consumer experience, because we're hearing from people that this is complicated. And so what we try to do is take the now 130 plans that people have to choose from and try to make that simple. And that is not an easy thing to do. So if you come to us, you can get a tax credit, which can lower the amount what you pay sometimes to by 75%. If not, last year we had people that had $0 premiums. Not so much this year. They're still very low dollar premiums, but the premiums also dropped for what's coming into 2020. So we've seen the reinsurance actually drop the amount of the advanced premium tax credit, the APTC, which basically means you get your tax credit early. And so it reduces the monthly amount you pay for your premium.
Okay.
And so it's kind of like a big coupon.
Okay.
Right. And so rather than wait and get your tax return when you file, you're able to get that money every month because you have health insurance that you buy through the exchange. Okay. Now, we see a lot of folks that will say, "Well, I went online, I'm getting all these emails and spams and calls." That ain't me.
Oh, because I get a call 3-4 times a day. And then every time you're like, "Can you please remove me off your list?"
Yeah.
They hang up on you. I'm like, that's not helpful.
I've heard so much of that this year. We pay Google to get to the top of the search, but apparently somebody's paying a little bit more. So we're going to have to figure out a way to make sure we're investing. We literally had a meeting on this yesterday. And I said, we've got to figure this out, guys, because I hear this now consistently from people.
Yeah. I mean, literally, I get phone calls starting at like 7 o'clock in the morning. And then my biggest thing is like, is this legal that you call me so early? Like, I mean, yeah. You know, as soon as you ask for anything, they just hang up the phone. And so I've tried pressing every number button to like see if it automatically enrolls me.
Yeah, but we have a number of different ways. And so if you want to go into, we've got a number of different assistance network sites. So if your community-based organizations do a lot of this work, because, you know, folks that are used to working in certain communities, they're used to, they're more comfortable talking to folks that they're already talking about other stuff about. So we get that. So we try to partner with those folks like Servicios or, just depending on where you are, we've got them literally in every corner of the state. So we try to make sure that we have someone that looks like you that you can talk to about your healthcare needs. And so we do that. We try to make sure that we have the right kind of outreach. We're in the urban spectrum. We do our African American churches every year. We do the whole shebang to make sure that we're going to folks. If they have questions, we just give them our information. And we hear things from folks that are business owners that are trying to figure out what to do with health insurance, folks that are retiring and trying to figure out what they do with that transition, because maybe they retired early, but they're not ready for Medicare. So what do I do with that little period? I'm new to the state. I don't really understand what I'm trying to do. So where do I start? Or my kid's 26, Kevin, what the hell am I supposed to do? Because that actually happened to me when my son moved back from Baltimore and came back, and I said, you're going to go on the exchange and I'll make sure of it, because I don't want to get that bill if something happens to you. So we made sure that he was covered, and now we got his own coverage, everybody's good. But those are the things that we try to help make sure that people can deal with. And where you're used to having employer-sponsored care, this is such a big change for folks. And so I think people sometimes are like, well, I just don't feel comfortable asking anybody, but it's okay. That's what we're here to do.
Absolutely. No, and I think that's important, because one of the things that, I always consider is I push entrepreneurs in particular, and that's just mainly because it comes to us, but I push the community and entrepreneurs to really ask themselves if it is an issue of not having resources, or if it's an issue of not accessing the resources that we have. And so from your perspective, I don't know if you have data that tracks that, but what are you seeing in terms of trends with the Black community, like actually coming in to access these resources and have an understanding of how their healthcare works, what they need to be doing? And I'll even just say, like myself, my partner, my girl Shay J, she doesn't know what happened to her, but she's an entrepreneur, full-time entrepreneur, and she doesn't have healthcare insurance. And I had told her, I was like, well, actually, I tried to get her to be here today. You can see she ain't here. I'm about to call her, right? I'm about to call her out right now and just say, this, in my opinion, this is another instance of a difference between having access to the resources versus actually, utilizing them, right? And so, so she just recently went through this medical situation that she's still in. She doesn't know what's wrong with her. At the end of the day, the reality of it is that she's looking at having some out-of-pocket expenses and out-of-pocket costs. And so, as I was mentioning before we started recording, is I'm a veteran. I'm a 70% disabled veteran. So when I think about healthcare, I'm not even necessarily all that concerned. My kids go on their father's policies. I have my own policy. My family's good. I don't even think about it. But so when I get entrepreneurs that ask me, this is honestly an area that I haven't focused on. So when she started talking to me about it, I was like, I don't know what you should do. I mean,
well, I have a couple suggestions.
Please, suggest a way.
The timing of this, I think, is really important, because a lot of folks think that the open enrollment period is over. It's actually not in Colorado. You still have time to get covered between now and January 15th. So you got a week, so we can work with you to make sure we get your girl covered, because that's what we're supposed to do. And so I do think it is a lot about making sure you know how to access the services that are there. I'm not saying that we don't get services, but I think if we don't leverage what we do have access to, we're starting at even a larger disadvantage than at least using what we have, and then talking about what we still need to have to bring equity. I think still is a fair conversation, but you got to use what you have. And we, I think, as an African American community, don't use our own God-given talent enough to do that. I mean, it's so interesting you talk about this, because I think a lot of the folks that we work with are business owners. And I talk to folks all the time about, if you're going to do your thing, work hard for yourself. I'm working with my spouse to make sure she's getting her business up and running. And I get it, it's not a small endeavor. It takes money. It's a grind. I get it. But you get so much more of your own control of what you're doing and your own passion, and you get to work in the way that you want. And then if you're passionate about it, you're not going to feel like you're working that hard. And you're going to be able to do things that I think you will bring more value to. And to me, it's so funny. I was with my kids, they're in late 20s, and they had not seen Hollywood Shuffle. And the only reason I bring that up is I think there's a generational issue with folks that are saying, the whole line about there's always work at the post office. Well, one, we know that is not true, but we've gotten ourselves to think that we always have to work for someone instead of ourselves.
Right.
And I am challenging that with as many people as I know to do that, because I think that actually is the way to talk about financial freedom in a different way that we have not done in our community nearly enough.
Absolutely. Like, one of the things that I love is really the discussion of options. To me, that's really what it's about. And so when we think about equity, and I was actually asked this question just yesterday. I was doing an interview, and the question was like, what do you consider for, Black liberation, or what would you look at as being successful, right? And that's what I said when they asked me the question. I was like, what would we consider being successful? Because I think that it's such a broad question, because ultimately we're dealing with something that is so deeply historic and rooted in like hundreds of years old, of a system that has been woven together so intricately that oftentimes one of the things that frustrates me is when people feel like there's going to be one thing that like unravels the system. And I'm like, that's asinine. And so, but what I do think when I think about what some sense of liberation will look like, comes in the form of options. And when we don't feel when we go into the workplace and then we have pay equities and pay gaps, right? Or we decide to become entrepreneurs and then we struggle with an entirely new set of things, from not accessing capital, not necessarily having access to resources or mentors, being denied certain things. You look at redlining from a housing perspective, but you can also look at redlining from where you're able to open up your business. And I'm glad to see the internet coming in as kind of being this potential source of some neutrality, right? Where you may not know who's on the backside of that business, right. And so if you like what you see, you might be more inclined to purchase despite who's there. And of course, that's marketing and all of this. But I think that looking into how we create options for ourselves, and when I hear not just necessarily in the exchange, but in the idea of how we create freedom through financial freedom and things of that sort, and thinking about entrepreneurship as an option. And I think it's because we struggle with the value of ownership in anything. So we're not owning what some of our issues are. We're not owning the solutions that may exist or may need to be created. And then in that sense, oftentimes when we're looking at what it is that we want to do to kind of create this life that we want to live, we don't really look at all the options that exist out there, with ownership being one of them.
There's not much more to say. I think that's exactly right. I mean, you think about, it's so interesting because, I was listening to your, one of your earlier podcasts, you're talking about gentrification and that whole thing. And, I grew up in a very small town in Texas. And my wife thought it was like the 50s when she came and actually visited some of my family. Because she's like, wait a minute.
I've had that experience.
Right? And you're like, what is going on? She's just like, I think it still shocks her to this day.
You said Houston?
Corsicana, just south of Dallas.
Oh, gotcha. Okay.
Right on I-45.
Or you went to school. Where did you say you went?
So undergrad, I did Sam Houston State.
Oh, Sam Houston State. Okay, that's where I heard Houston. Yeah. I was like, I thought you
said Houston. I taught in Houston.
Okay.
I taught in Houston. But it's different, right? And so trying to break from, it's a mindset kind of question that a lot of us, you're not taught to take risk, even when the risk is yourself. And now when you think about the way that the structure, the economics of everything works, those great union or great paying jobs that were in the community or close to the community aren't there anymore. And so now it's like, well, now what are you supposed to do? Because if you don't have some sort of specification, something you can monetize, what are you supposed to do other than a service which they can easily replace either by automation or by another person? And so you have to start thinking about what you have as your own intellectual property, what you have as your own talent, what you have your own skill, what you can do differently, or some perspective that you bring that people will say, oh, okay, that actually helps me do something, either live a better life, make more money, make something easier for me. I'll pay for that. And I think we have to make that shift as a people to start thinking about how do we start thinking about how we transition into this new kind of economy. And one of the big things that I got into arguments about, even when I was on the school board, is people were talking about, well, we got to have everybody go to college because everybody needs to be in college. I'm like, I get that,
right?
But if somebody's calling you and it's the middle of the night, somebody in India is not going to come from a plumbing call if something's messed up at your house.
Right.
You've got to be there. That's going to be something you can hang a state certificate and open up your own business, being a plumber, an electrician, a lawyer, an attorney, an accountant. All those things are state certified certificates that you can hang to either go work for someone, but you can also, that someone can be you.
Absolutely. And I think that is one of the things that becomes so controversial because my whole education, everything is that, first of all, I homeschool my kids. So I've already like opted out of the traditional school setting.
I get that.
I think it's interesting because for me, a lot of it just, circulates around the misinformation that's still being put out there. I mean, it is like, so just in this past Thanksgiving, so 2019 Thanksgiving, my sister is still posting pictures of my nephew in kindergarten. They still doing Pilgrims and Indians. I'm like, oh, we still doing that in 2019? Oh, okay. And of course, she lives in a predominantly white area, and her husband is the first Black coach that has been head coach that was hired at the local high school and everything. And, he's doing all types of great things, but that kind of perspective, he's the first Black coach hired in this, area, right? So that's kind of where they live. And I was like, oh, this is what we still teaching our kids? Okay. That's why my kids ain't in that system. But, to that end, as a person who's gone to school, gotten my bachelor's, gotten my master's, and then now seeing how it negatively affects, it literally brings me back to one of the first things that you said is how they teach you budgeting and then what budgeting really looks like, right? And it's like, they teach you about these ways that you are to be successful, but it's how do they actually make us successful? And so when I think about certain things like the high attainment rate of African Americans specifically in college, getting these college degrees, or at least going to college, but going to college, graduating from college, being straddled with these student loans, people continuing to go back for higher and higher and higher degrees. I'm like, I know a lot of doctors. They make no money. They're struggling. They're not, even when they open up their business, they don't know how to monetize their expertise. Right. We're not learning the right types of skills that really help us to navigate this new world of monetization, and how you take something that you're good at and be able to turn it into something that you can then, make money from with your intellectual property or, things of that sort. And so when I'm watching this phenomenon, it literally hits on all of the sectors. So now you have this degree, but you're straddled with debt. You can't purchase your home. Now you're struggling with credit issues. You add in, it starts to become this very layered area where we think we're going after this dream, and the dream isn't built for us, not in the way that we know it to be. And so everything that we do, try to take steps towards assimilating into, white society, essentially, actually generally tends to take us steps and steps and steps back.
I guess the analogy I would use, I grew up as a musician, and you learn all the chords, you learn all the scales, but the ones that get the renown are the ones that know what to do with the rules and how to change them in the way that does something new and different with them. And I think the problem is with education, it was built to do a certain sorting 100 years-ish ago, and has not been able to keep up with the way and the rate of change that's happening in our economy and in our world. And I think until we're able to figure out how do we start catching that up, I don't know how we get away from the problems that we're having, because I would tell people all the time, it's not like 100% of white kids are scored proficiently on the state test either. So it's a problem that we've got to figure out, okay, what are the right kinds of skills, and how do these children what do they need to know to be successful for what's coming at them? But some of it is we actually don't even know what's coming at them.
Right, exactly.
Because as soon as, literally, when I was a kid, this job didn't exist. When I was here 10 years ago, this job was thought about, but it didn't exist yet. We're talking about now, this will be the 10th anniversary of the Affordable Care Act. Well, that was just a law passing. That didn't mean these things were happening and these positions have been created. These are things that are just happening almost in real time.
They are, and I think that's interesting because I'm working on this address And so I guess I'm kind of sort of putting it out there now, but I'm working on this address that really looks at the trends over the next 10 years and what we should be expecting as a community, because I do feel like we are oftentimes so far behind. It's like by the time something is already, by the time we know as a community that something is happening, it's already, we're, you now for the last couple of years are hearing about Black kids and getting them into STEM and STEAM education. And I'm like, I mean, that's old news now.
I would say I would agree with that.
I mean,
it's not a new phenomenon.
It's not a new phenomenon, right? But it's like now it's this like it's still this buzz. It's like you buy this STEM box, buy this STEAM box, participate in this STEM class, and it's like we're so far behind the curveball and all these things that we never keep up with or foresee where trends are going and how to create things that are going to benefit us.
So I think the challenge really is, for African Americans, we are so risk averse.
Yes.
Right? We're so conservative in a lot of things because if something to go wrong, because you're always taught be ready for the worst thing to happen. Well, but what if the best thing happens? Mm-hmm. Then you're really not prepared for that. I mean, that's the other side of that coin. And so I think we have to be able to think about not doing what we think is comfortable all the time. I think we have to be comfortable being uncomfortable, and think about looking at the assessment for the child that you have. It might be easy to send them to the school that's down the street because, I got to figure out how to get to work. I got all these things I got to do. I get that. I've been there, done that, understand it too well. But it's also a question of, but if this is what's best for your child and it requires a little bit of difference in what you have to do, then let's figure that out. And I think we've got to get there a little bit faster.
That's the epitome of my life.
Right? I mean, did I say something wrong?
No, it literally is. Like, I'm an entrepreneur. So I don't clock in, clock out anywhere. My income goes up and down based off of a variety of different factors, right? And as you were mentioning, like it's a hustle, it's a grind that you've got to really, work at and perfect and build these systems and all those things. And yet I homeschool 3 kids because at the end of the day, I feel like the school down the street is not the school for my kid, and most of the schools, in my opinion, aren't the schools for my kid. And so then it puts the onus on me to think about, am I going to do what's easiest or am I going to do what's best? And when we stay in those places of complacency and we are very risk adverse, those are often times where we are doing things that are easy for us, not doing the things that are best. It's easy to just send your kid to the school down the street. It's not necessarily what's best.
No, I mean, with my kids, they were both at Denver School of the Arts because I'm, history of musicians on my side of the family. And it was work. I mean, they were, you got to get them to lessons once a week because you had to do that. You had to get them to performances. There was one year they had 66 different performances
in one year?
In one school year. 66. I was at all of them.
Hey.
And I got them there. But that's what you have to do because it was like, they're loving this. This is a great experience for them. It wasn't for everybody. And it was helpful because I at least had a music background to kind of help support them and get through that. But it didn't mean that it was automatic.
Right.
It was work. And both of them are just very different people. One worked really hard and was really dedicated. The other one was a natural talent and didn't, did what he needed to do, but he's like, yeah, I'm good.
Right.
Because they're different people. But you've got to give them room to be their own individual selves because that's what they're going to do.
Absolutely.
They should do what you're supporting. So.
Absolutely. And so, what
are we supposed to be talking about? Because that was fun, but I don't remember. I think that's something I'm supposed to say. Though. That's funny.
Well, I mean, as I said, this is just a free-flowing conversation. Ultimately, we do want to make sure that we are bringing some awareness to the resources that are available. And if you're someone who's not inside of Colorado, I still think that these are things that are important just for us to know and understand. And just the whole idea, like I said, about, accessing the resources that are available to us. But, ultimately, look, we're just talking. So that's good. My last actual question was around trends. If you have been seeing trends inside the Black community with regards to like accessing the resources. So in this case, from the exchange perspective, are there things that are happening inside the Black community that you see that we should be more aware of, or do you feel like based off of the percentage of Black folks that are here in the state that, you know, there's a good representation for accessing the services?
Yeah, I actually think that we are missing some folks. So here's what I typically see is where I think we're missing folks. So let's say I'm working, I got a job, I don't think, you know, I'm not on Medicaid anymore, and I'm working, but my kids are on child health plan, so they're getting CHIP. So, you know, that goes up to about 250% of poverty. You know, our program actually kicks in at 200% of poverty, but you also get a cost share reduction, which actually helps pay a lot of the out-of-pocket costs up to 260. And so there's a lot of folks, I think, that their kids are on CHIP and they're working and they think that they don't qualify for anything. And those are folks that actually would benefit by coming to our program.
Okay.
And I've heard people say this because I was talking to a guy who works at a brew pub, and the owner came and says, Kevin, you got to talk to this guy because I think this is somebody you need to see. And the person came and he says, look, I was on Medicaid, I got the Medicaid expansion, I took some more hours at the job here, I lost my Medicaid and I didn't have insurance. And I'm like, dadgummit, that's my enrollment. You're supposed to come to me. But he just didn't know because it's so different when you're on Medicaid and when you're on my program, but the federal government thinks of it as just one long continuum of services that they provide. But Medicaid, you know, you have to produce your check and it looks at your monthly going backwards in time.
Mm-hmm.
My program looks at it annually going forwards in time. So you're literally not even the same plane of existence.
Okay.
One's living in the past, one's thinking about the future.
Right.
And so when people make that transition, they're like, what are you talking about? It's a different language to them.
Okay.
And so they transition from saying, well, Medicaid pays for everything, so I don't have to worry about it, to, wait, now I got to figure out, wait, what's this out-of-pocket cost thing you're talking about?
Mm-hmm.
Co-pays? Okay, well, I had to pay a couple of dollars here and there. It's like, no, if you go to the hospital and your kid goes in the emergency room, that might be $300, not including what actually you get served to do. That's just showing up saying hello. And people are like, wait, what? And so it's one of those things that people are thinking this insurance is something that is kind of like, you know, it's just, well, you know, it's just something I just kind of have to deal with. It's like, no, you have to think of it as your car insurance.
Okay.
Like you have it in case something bad happens, but you don't take off your seatbelt and run into something, so you use it.
Right.
Right? You know, you use it in case something happens, and it's there to provide a safety net so you don't lose everything you have because something strikes you with something and you didn't see it coming.
Mm-hmm.
And so I just try to make sure people are prepared.
So do those types of services, or I assume that plans on your exchange then also allow for preemptive services?
Yes. So there are, so it's like it covers certain preventative services. And so, you know, there's some programs that have a certain number of well baby checks, or they'll have, you know, your physical will be at no copay. You might have different tests, and the tests can be different prices depending on which plan you pick. And so what I try to tell people is if you don't think you're going to need it, but you just want to have something just so you don't lose your house, you probably want to have something that's a high deductible plan, that's a low premium, because you're figuring, you know, I'm really not going to use this, but I just don't want to get caught and lose everything I have, because I've seen people with bankruptcies over medical bills. It can happen in a heartbeat.
Right.
Literally heartbeat. And then there's some folks that are like, no, I've got this condition. I know I'm going to be at the doctor. I know I've got my prescriptions. You probably want to have a silver or gold plan, and that's going to be a higher premium, but your out-of-pocket costs are going to be already calculated in that premium. So it's not going to be these big costs that you have to come out of pocket with all the time. And so there's different ways that you can kind of plan around what you think your medical need will be. But it's important for people to think about those kind of scenarios and play that out. And so that's why we do it, whether you want to call into our helpline, or you just want to go online and look at our plans, because we've got a cost plan tool that can just lay it out so you can see side by side, this plan does this plan does that. You can just see it all there on there. And if you decide that's the one you like, you can click, it'll take your information and just then say, yep, you can use my information, because we don't want to let people shop anonymously, and then they can assert that that's them, and then we can get them into the process, because we deal with health information and tax information, so it's very secure. So we have to be really, really careful on how we treat people's information.
Got you. So I want to just highlight a couple of things that are coming to mind as you're kind of walking through that process. So one is that people can shop anonymously. One of the things that I have learned through my own medical journey has been around our advocacy for ourselves and the things that we assume, right? So it's I assume I can't afford, so I don't even go and get the information, which I think is highly problematic in and of itself. Like, go and get the information, because how even then, let's just say, for shits and giggles, you can't afford it. How do you even know what to plan for?
Can we say that?
Yes.
Okay.
Right. I had to give him my warning, like, y'all know I got a foul mouth. I'm really trying to, hold it together. But yes, so let's say, how do you plan if you have not actually gone to find out what it is that it's going to cost, right? So you feel like I can't afford it, which might be true, but you don't even know what options exist so that you can begin to budget out and figure out what you need to do in order to be able to afford whatever it is that you need to afford. And thinking through that from the preemptive side, I can't even remember. I feel like it was a live video because I think we were talking about body positivity, but which is a whole interesting conversation to have. But nevertheless, I was, talking about some of my own health journey. And so, I mentioned before, I'm a veteran. I have VA coverage. Not that I think VA coverage is great coverage, but it's coverage that doesn't come out of my pocket. So it's something that I really don't think about oftentimes. And I have the ability, when I need something, to just go to the doctor. But I ended up going to the doctor because I had been struggling with fatigue. And I'm thinking, people give you all the excuses, right? We will be our own doctor. We will be on Google and the Mayo Clinic, and not that I've ever done that myself. And diagnose ourselves, right? And so here I am, and I'm getting all the reasons why I'm tired. Girl, you had a baby, you had 2 babies, you was breastfeeding. I mean, people are telling, oh, you do everything, Jice. Every time I turn around and I see you, that's why you're tired, because you just do too much, right? So people will give you all these reasons, and I let people give me those reasons, and I didn't really question them. I'm like, you know what? That sounds right. That's exactly why I'm tired. So I go to the doctor because listening to a podcast, I heard this woman talking, and the way that she described how she was feeling, it literally spoke to my soul. I was like, yes, this sister and me is on the same page, right? So it turns out she basically went and had a blood test drawn. So I'm thinking, well, I should probably go. It's been a while since I've had a physical and a workup. And that's something also I think that we should address, is how often we are not going in and really finding out where we stand from a medical standpoint, and what that looks like for us. And it's so important, because if you think that you're the shit now, like I think I'm pretty dope, I'll pat myself on the back. I do a whole lot. I know from the time I get up to the time I lay my head down, I always say I have earned my sleep tonight. I know I have. And so when you go through that process, and I think now, knowing, and I'm about to talk about that health, but and now that I know where I stand from a health perspective, the reality is I feel like I could be doing so much more if I was in a better health, situation, right? And so what ended up happening was I get these blood tests, and I'm basically like devoid of all nutrients in my entire body, like so much so that my vitamin D doesn't even show up on the blood test. Like there's no vitamin D in my body. My iron level that's not good. It's not. I mean, I'm laughing about it because I had time to process it, but it was like, just to give an example, I was told that one aspect of my iron should be between a 19 and a 30. Well, my iron is at 5. My vitamin D is like non-existent. So it's just the idea that for these last few years, I've allowed people to put this idea that I am this way because of all these reasons. And it's like, the reality of it is I'm devoid of nutrients, right? And so there's a pathway in which I can get myself some help. And so now I have a plan and some things. And whether I go through the holistic path, which is, more of my choice, but holistic doctors are not running blood panels. You still got to go to the doctor to get that, to get those types of things done. So I think it's important for us to acknowledge that we should not be self-diagnosing, and that oftentimes we are not taking advantage of the fact that we can go and get some things preemptively done and have ourselves assessed. And that when we are operating like that, we are not operating at our best selves.
So I'm not going to talk to you because I don't know you that well. but let me just
I have
speak in
tough skin. I got
generalities.
thick
No,
skin.
I'm not gonna, it's the first time. I don't start that way with people. One, I think we do need to deal with this old African American thing about not going to the doctor.
Mhm.
I would hear it all the time. Because you know why we don't want to go to the doctor? Because the doctor will tell us what we already know. We
That
know
something is wrong.
we know what's going on. We know what we are or are not eating that we should or shouldn't be eating. We know that we're not doing this or not. We know those things. We just don't want to hear from them because then we're gonna have to deal with it.
Right.
So there's a piece of that. But I also think that, and I had this conversation. I was in South Carolina during the presidential stuff, a whole nother conversation. And the question came up to a friend of mine who was running for president at the time. You know, what's going on with infant mortality rates in African American women? And, you
I have
know,
stories about that too.
but I think the underlying issue is there's not great research and they're not listening to Black women.
Absolutely.
I think it's a really simple question, but you know, we are our own worst advocate. And I think Black women are trying to take care of everybody else so much that they have to stop and take care of themselves. And I think you got to be your own best advocate, even if you're going to, whether it's holistic medicine or however you're getting it. You have to keep talking until it's like, no, that's not that. No, that ain't it. That's not. I'm telling you this because they sometimes have to go through a certain number of clients that they have to see. That you don't know what's going on their side. You got to make sure that you're speaking until you feel like you get the answer that resolves whatever it is you're looking for.
And ask questions.
You have to. You got to go in there with a little pad and paper, write that stuff down because they're gonna be like, what did you tell me again? Because some of that stuff will be overwhelming. And you know, I've gone in with family members and they're like, what did they say? They said one word and I kind of stopped listening after that.
Right.
And those things, you know, you've got to figure that out. And you know, there's stuff I have to figure out what I'm doing with my own nutrition and figuring out what I'm doing with my own sleep. And I'm like, yeah, I kind of know, but I got to do it. I got to do better.
Right.
So, and I think we all have to challenge ourselves to make sure that we're doing that. And you know, the diet that we have inherited as a people ain't always the best thing for us to be eating.
Absolutely.
So we have to look at how do we have the right kinds of things to still have our culture, but eat it in the right way. The big red book, the cookbook, Black Vegans, you know, all that stuff. I get that now. I get that now. I can't do all of it, but I'm working on what I can.
Right.
And so I'm a work in progress. And I think we all have to see ourselves that way. Is you know, we're trying to attain perfection, but we're not assuming that we're going to get there. But if you can make yourself better, that's what this is all about. And I think it's really important. I tell people this too all the time is you've got to make sure that you're doing what you can to be there for the people that you care about in your life. Don't do it for you. Do it for them.
Right.
Because they are going to want you around. They don't want to have to deal with you sick and you can't move, you can't get up. My diabetes is good, but you know, all that other stuff. You know, you can do something about that if you act in a way with some urgency about it. And I think that's really important around health because let's go back to the auto insurance. You can total your car and go get another one. What you gonna do if you total your bike?
Right.
Can't trade it in.
You cannot trade it in. And I think that's an important aspect of legacy because oftentimes when we're talking about legacy, and I know I'm guilty of this, and that's part of why I have begun to change some of this, is we think about legacy and we think about generational wealth in the terms of just money, but it is so much more than that. It is the type of mindsets that we're passing down. So when we were discussing body positivity and I was acknowledging that most of us have grown up with being chastised in some way, shape, or form about our physical appearance, right? It's like, you're too big, you're too little, you know, your hair is too kinky, your hair is too straight, you're too light, you're too dark. I mean, it's never, you know, you're never good enough, right? And I had acknowledged that I had said some things to my daughter that once they came out of my mouth, it's like, I realized like, oh, I'm going to give her a complex about herself, right? And like, those are things that we've passed on as well. So then when we think about where we stand from, you know, when we look at the thing like cosmetic surgeries being on the rise and people talking about body positivity, but really still people struggling with changing themselves, people struggling with suicide, people struggling with depression, all these other aspects. What other places and things are we passing along besides just money? Money being a tool and a resource that could help mitigate some of these problems, but by far doesn't. We already know that people who are very wealthy struggle with image, struggle with, mindset, struggle in, some of these areas. A lot of them are not very healthy. A lot of them do these, different types of surgeries and things like that. So how do we begin to have a more holistic approach to what it looks like to pass on something, and health being a factor, passing on good eating habits? We be feeding our kids the worst stuff, sending them off to school. They can't focus, they can't function. That starts a whole cycle. But also, we know for a fact how addicting sugar is, right? So it's like, what are we passing along so that by the time they become adults, if they're struggling to get their health in check, and then subsequently, generationally, we're passing along these poor health habits.
It's so funny you say that. I mean, I grew up, no indoor plumbing. We had chickens in the back.
Mm-hmm.
We grew our own vegetables, not because we had a farm, because we had a piece of ground.
Right.
We just, that's how you had vegetables. And we used everything on the chicken except the comb and the beak.
Mm-hmm.
Everything else had function, because you didn't want to waste anything. And we had free range chickens when the chicken coop had a hole in it.
Mm-hmm.
We weren't doing it because it was trendy.
Right.
We was doing it because we would survive. Right.
Right.
And it's so interesting to kind of think about now at the stage I'm at, and how all these things are now like, oh, wait a minute, maybe these things aren't so bad. And what's that Netflix thing where they talk about the food? The guy does it. It's an author. He does Salt. Is it Salt? Or it's the one with the four? It's the one based on the four elements. It's a guy that does it, and he talks about, and he actually brings the guy that kind of started this whole thing about what they were doing with processed foods,
okay,
and how they were trying to figure out how they were going to take it from the military, because that's where it came from. And they said, well, we got all this processed food. What are we going to do with it? TV dinners. And then they started creating TVs, and the TV dinners became the way. So it was basically, it took an MRE and turned it into a TV
which
dinner.
Are not good.
No.
They are. Not only do they not taste good, but anything that's sit in that package like that in cold weather, hot weather,
but you understand the functional difference.
Yeah.
And it explains that whole connection between the fats and the sugars and how it triggers the dopamine.
Right.
Just like it would any other kind of addictive substance in you.
Right.
You have to put it on there for folks later. I can't think of the name of it, but if you have not seen that Netflix,
I have not seen that Netflix.
You have got to see that, because it explains it in it's so easy, and it's a great timeline.
Is that it?
Hold on, oh good Lord. I touched the phone. I'm an iPhone guy, and I touched an Android, and I don't know what it is. What the hell? Is that the one? Is that the one? Mm-hmm. There's a different one too. There's a different one.
Yeah, because I know about What the Hell. That's not, yeah.
Yeah, there's a different one. Because there's I think a Lebanese lady that does Salt, and because she talks about the elemental parts of what's important in cooking good food, whole foods, and he talks about it in the elements. It's air, it's the earth, it's water, and fire. So he has all of those things, but it also talks about the fermentation, like of sourdough bread, and it talks about fermentation and how they use it, especially in Asian cultures, and Central American cultures, and all those other things that are just good for your gut. And all, I mean, it's just, I think it's just one of those fascinating things that's just easily accessible.
Right.
It's out there, but I can't remember.
And it's probably that cross between the education and the entertainment, because we struggle with that piece of, are we going to educate ourselves, or are we just going to be entertained today?
I thought I was going to be entertained, and I learned something.
Right.
And I tell you, it's like, okay. So my grandmother used to do this all the time. If we didn't have it there, we'd stop at the store almost every day, because she said you want it to be fresh, and it's so important.
Right.
So, anyway.
No, so I want to thank you, because I know that our time is coming down to a close, but look, we didn't went all around the world in this conversation.
We did.
I don't even know where we're supposed to close.
So I got a couple things if I could just do a couple of tags. Before we leave. So if people are still trying to get on, you can find us on Twitter, you can find us on Facebook, you can find us on our website, connect4healthco.com, 1-855-PLANS-4YOU. You can just find us. If you have a question, there's no dumb question in this. I was
we'll
talking.
have all that information in our description box.
And I just want to make sure, because people, when I left the state, I was trying to explain to the people I was leaving. It's like, Kevin, I'm trying to understand, what is it you're really doing? And I said, at the state, you have 2 carriers with 2 planes each. So it's 4 choices you have as a state employee at the time. I have 125 last year, and now it's 130. And they were like, oh yeah, that would be hard. And so if you don't know where to start, a lot of people just give up, and they're like, it's just too complicated. We have tools that will make that easy. We have people we can have you talk to that just will ask a few questions from you. They can get you to the right places. It really doesn't need to be something you should be afraid of. We're here to help. We just want to make sure you get the right kind of help to lead a healthy life.
Absolutely. So thank you for that. And so I said all that will be in the description box as well. So make sure that you check that out. And then I'm going to give you our closing thoughts.
Closing thoughts? Oh, I did not thought that's what I was doing. So I was kind of done. I didn't get anything else. I don't know about anything. So closing thoughts. I think it's really important for folks. Here's the one thing I will say that I think is important that I'll ring again from you. We talk a lot about how we have our reputation and how people think about us. And I don't think we spend enough time with our own self-esteem. And I think we as a people need to really be mindful of how we think about ourselves. And we need to have more time to be reflective, but also on an internal side to make sure we're thinking about it. Because I got to a point in my life where I was doing things that was just like, it almost became automatic. It's just kind of like driving. They're like, we're really not thinking about it, end up where I'm supposed to be. And my wife was asking, well, Kevin, how do you do what you do? And I'm like, that's a dadgum good question. And so now I'm actually more into thinking about, putting things down, writing it out, journaling, trying to think about looking at themes, trying to assess and understand. And, as I go to now more funerals than I do weddings and baby showers, you begin to think about what you want your life to really be and how you want your obituary to read. Not in a morbid way, but to say, I've spent this time on this earth. What was I able to do? Who was I able to help? What roles was I playing, as Shakespeare loves to, loves to talk about? Life's a series of, we're just actors and we're playing our parts. But you got to think about what parts are important to you. Your part as a parent, your part as a brother, sister, your part as a child, a parent. All those things are really important for you to think about, but you have to be mindful about it. Absolutely. They don't happen accidentally. And we get so busy in those things, we've got to plan those things out and think about what we want to do, because the time goes so much faster as you move through life. But if you start early and you really invest in the things that are important to you, there's no telling what you can do or what you can achieve. So I just think I'll just leave people with that.
And there you have it, folks. Well, we want to thank our sponsors here with Connect for Health Colorado. This has been another episode of Boss Up with BBI, and we will see you next week.